everyone. My name is Dr. Parveen Vahora, and I'm here with Dr. Teresa Sisodia with My Choice Primary Care. Thank you very much for having me on My Choice, but I'm going to ask the questions today.
Sounds good.
So, Dr. Sisodia, what prompted you to start your practice? Tell us a little bit about what led you to private practice.
I think that after 25 years of working for someone and realizing that the person I was working for wasn't the patient, and I'm sorry that it took me 25 years to figure that out, I realized the different parts of my career that had been less than satisfying were those moments where I wasn't allowed to customize care or to spend time with patients or to break down the barriers that put distance between you and your patient. Like in traditional offices, how many times do you hear the front desk being rewarded or commended because they were able to take a message rather than get the patient to the physician? And then what happens? They take a message, then that message goes to your MA, then maybe a day later, the message comes to you. By that time, your poor patient needed help, needed guidance. And so for me, there's a passion to help people. And I know that sounds trite, but there's a passion to be there for my patients, to have a relationship with them, to be that safety net for them. And those things are not available to them in a traditional practice. The only way I could do it would be to create something like this, an environment where I have time to talk to people, to listen to people, to formulate plans. If I don't know what to do as a board certified physician, I certainly know who to get them to. And if you just look at the statistics, there are more women on this planet than men. So I end up doing a lot of women's health, not only because I'm a woman and I think that attracts women patients to us, but because there are more of us. And so it's great to be able to have you on my cell phone, be able to text you and say, hey, this is what's happening. What do we need to do? Help me help my patient. It's wonderful. I get to learn with the best of people because of people like you that are also doing boutique medicine that will help each other. So we become our own little community or village, and we're able to actually give our patients top-notch quality care and timely care. And it's just really rewarding.
Yeah, I tell my patients all the time, when I'm referring you to a physician, I only refer you to someone who I have a cell phone for, so that way I can reach out to them. Because nowadays, with the corporatization and the hospitals encroaching on private practice is a dying breed. So it's very refreshing to see that you've embarked and chosen to join private practice. And I'm just so excited to have another fellow private practice to send my patients to. I've been in private practice for 20 years, and sometimes it gets a little lonely, but I have a good circle of friends, which I call circle of care. And all of these physicians, I actually have their cell phones and I can text them. And I don't refer to anyone who I can't text.
I think that's so important. Just today, I had a friend of mine call and say they really needed help. It's Friday afternoon. What happens Friday afternoon?
Oh,
Specialist office close. Patients are left with urgent care or emergent care when they may not need it. Maybe they need it, but they may not need it. And he reached out to me and said, I have this problem. What can I do? I got on the phone and I got him a same day appointment.
right.
So the problem's solved. And we talk about protecting resources and how medicine is overutilized and how you shouldn't do an MRI because that's too expensive and you should do an X-ray first. Well, by the time you go through these algorithms, sometimes they're more expensive than just picking up the phone and talking
Yes.
to your board certified colleagues and saying, this is what we're dealing with. What can we do to expedite care?
Right. And your goal and my goal is we want to take care of the patient, right?
That's
We want to
right.
make sure that the patient gets the care that they deserve. And by being in private practice, that allows me to do that. And I know that allows you to take care of the patient and put the patient first.
I love it. I love it. Thank you so much.
You're welcome. Thank you.